I wore 54 long jackets and 46 pants and 12 size shoes. And yesterday I bought because of her, my wife's going to kill me, but I bought this wonderful suit jacket on sale. Anyway, it's a 44 long. And my pants are 36s, and actually I'm ready to go into 34s. And my shoes went from 12s to 10 and a half. I don't take any more. I don't take any medication. At the time after surgery, he took me off of. Dr. Rutledge took it all away, and I haven't been out any of it since. So it's all handled. But every time I turn around, every week something more fantastic happens. I mean, like I said, I had back trouble before and had to have injections and so forth. That's gone away. I haven't had injections since the surgery, but. More importantly, in my knees, my left knee they were talking about replacing it a year ago. And after the surgery and the losing the weight, I kind of forgot about it because it wasn't hurting. But my family doctor said, you need to go over and see the doctor, the surgeon at Pratt, because they were expecting to do this. We better see where you're at. So I went over, and the doctor didn't even know me at all. Of course, we weren't on a first name basis, but he literally didn't know me. And he x-rayed, did all the tests and so forth. And then he came in the room and he was just smiling ear to ear, and he said, I guarantee you, you've put off knee surgery at least 6 years. He showed me my previous x-ray. I didn't have any gap between my knee joints at all. And my new x-ray, I had gap. And he said, this is unreal. So I was happy about that. Well, then the next week, I've been having trouble driving. On bifocals, I thought, I've got to have new glasses because I can't see nothing. And so I call my eye doctor, and I go up, and he checks my eyes, and he says, well, I can see why you can't see. He says, you don't need glasses. He says, what? And he says, when you lost all this weight and lost all that fluid, your eyeball's 90% fluid, it went back to the right shape. And I still use my Walmart readers for close in, but as far as driving down the road, perfect. I don't see two roofs coming at me on a car.
How long did the vision stuff take before it
Well, probably, I don't know, 3 months or so, maybe 4, but just the last month or so is when it really bothered me, because I'd get in the car, first thing I do is put my glasses on. That's what you do. Well, I didn't even think to take them off and look. That's all I would have had to do.
I've been having major vision problems prior to the surgery, which I'm only a month out, so I'm still having some problems. I mean, it's helped. I'm not having the problems that I did with my vision before I had the surgery, but I'm still having some, so that's why I asked.
I'm sure it'll take longer, but the 6 months goes so fast. You folks that are just fixing to have this, I mean, it just seems like, oh no, it's going to take so long, but my gosh, 6 months ago we were sitting right here where you're at, me and Susan, and I just can't believe it's gone this fast, and our lives have just absolutely totally changed. Yeah.
When you go to the doctor, does he call Dr. Rutledge to find out what he can and what he can't give you?
Oh, as far as medications?
Yes.
They know. Dr. Rutledge makes it pretty clear what we can and can't. So
They're welcome to call me, though. Just like I talk to regular people, I will also be willing to talk to doctors.
If you have to.
I gave my doctor a manual, the whole shot, but I don't expect her to read it like I did.
Yeah. Yeah, there was a medication that my eye doctor wanted me to try because I was having flashes around my peripheral vision, and then floating flashing balls in the middle of my vision would happen, 3 or 4 times a week. And I got pretty scared about that. I thought my retina's detaching or something. So I went to that eye doctor, and he said, well, I think, I can tell you're having migraines without pain. Now, I want you to take this migraine medicine. Well, see, I came to call Dr. Rutledge, and he said, well, I don't think so. He said, I want you to get this cuff and check your blood pressure 6 or 8 times a day, keep track of it. Well, it turned out I had low blood pressure. I've never had low blood pressure. I've always been up here, not down here. And then my other doctor at home said, well, your body will adjust to being low blood pressure, so not to worry about it. And Dr. Rutledge said those flashes were from the low blood pressure. And sure enough, it was. But that was a case where they were trying to give me a medicine that I was not sure about, and wanted to call Dr. Rutledge to find out.
Same situation with a steroid. My doctor prescribed a steroid. I right away called him, and he said, don't take it. So I guess the patient is actually the go-between.
No, your doctor also called me too. You know, the thing is that I think that, here's the important thing. These days, this is a really bad problem. In other words, people have a doctor for their ear, a doctor for their eyes, a doctor for their nose, a doctor for their bottom, a doctor for their top, for their feet. And so people often say out loud, and rightly so, this is awful. Why can't I get one good doctor? You know, instead of having to have all these specialists. In today's society, there's no person that I know that's smart enough to be able to be knowledgeable about all this stuff. Okay? So that does mean that the individual patient has a tougher time. Whether you have an MGB surgery or not, you're still in the middle of trying to get all this stuff managed. And I will help with that, as I helped in your case talking to your doctor. And I can help in a lot of cases. There are times when I'm not so sure. But it's an important feature for you to realize that in today's society, with the amount of knowledge that we have, none of us are smart enough to know all that we need to. And so that's exactly right. When you're at the center of all this, you sometimes have to jiggle the candy machine to work all the pieces together. And so it is hard, it's frustrating at some points, but what happens is basically, here's the deal. There's so much to know, no human being that I know of can know it all. So you're stuck having to deal with this. Now the beauty of Bud's story is he doesn't have an orthopedic surgeon almost anymore. He's losing his eye doctor, you know. He's probably losing his endocrinologist, you know. We're going to compact him down to just his regular doctor and me.